This message is about cancer in Rhode Island and what we can do about it working together. I am Dr. Wafiq Eldiri, Director of the Legaretta Cancer Center at Brown University, Associate Dean for Oncologic Sciences at the Warren Alpert Medical School, and a practicing medical oncologist at Lifespan with specialization in the area of colorectal cancer. Our research labs are located at Ship Street in the Jewelry District. Before coming to Rhode Island, I spent most of my career in Pennsylvania at the University of Pennsylvania and later as Chief of Hematology Oncology at Penn State University and as Deputy Director for Translational Research at the Fox Chase Cancer Center. I completed internal medicine and oncology training at Johns Hopkins University in the late 80s and early 1990s. Our research on cancer treatment resistance has led us to discover new drugs. One of the drugs discovered in my laboratory has been shrinking brain tumors in clinical trials, and we are currently working on ways of reducing the side effects of cancer treatments and boosting the immune system to fight cancer. I came to Rhode Island about 5 years ago with the goal of establishing a National Cancer Institute designated cancer centers. There are 71 NCI designated cancer centers around the country, and they have met the highest standards of research, clinical trials, community outreach, and cancer control. We don't have an NCI designated center in Rhode Island, but we've made tremendous progress, including building research programs and clinical trial programs and recruiting amazing colleagues. According to the American Cancer Society statistics that just came out last week for 2023, in the United States this year, it is estimated there will be nearly 2 million new cases of cancer and over 600,000 deaths. In Rhode Island, we will have over 7,000 new cases and over 2,000 deaths. The high rates of cancer in Rhode Island affect everyone in the state, and their patterns are different depending on where people live. So we have higher rates of a number of cancers, and unfortunately, it's multiple different common and less common cancers. So according to publicly available data from the Center for Disease Control, the CDC, Washington County in Rhode Island has the highest rates of prostate cancer, brain cancer, and leukemia in the state, while Kent County has the highest rates of lung cancer. Breast and bladder cancer have the highest rates in Bristol and Kent County. Thyroid cancer is highest in Newport County. Colon and liver cancer are highest in Providence. But the rates are higher of many of these cancers throughout the state. No one knows why. This could have something to do with toxic waste, ultrafine particles, heavy metals, pesticides, water, industrial chemicals, radon, and genetics among different racial and ethnic groups can certainly impact on the patterns and susceptibility to cancer. Part of the burden of cancer is that it's diagnosed too often at an advanced stage. People missed their screening and the cancer wasn't prevented. In recent years, COVID has impacted on cancer care in Rhode Island with delayed screening, prevention, and treatments. And this affects minority groups even more. Some of the barriers that lead to disparities, including enrollment in clinical trials, include issues of trust, language, culture, socioeconomic and other logistical reasons. Costs are some of the reasons that have been noted around the country, including here in Rhode Island. It takes many hundreds of millions of dollars over many years to build the type of world-class cancer center that Rhode Islanders deserve. This has been done at other universities successfully, and our colleagues who are leaders at other cancer centers are advising us. It takes government grants, philanthropy, institutional investments, and state support, among other resources. And this is what has worked well to build and sustain cancer centers around the country. Some good examples include the state of Texas that allocated $3 billion over 10 years, and this was renewed with another $3 billion in 2019 for the Cancer Prevention and Research Institute of Texas. Oklahoma, Kentucky, and Kansas have dedicated millions of dollars, some from the tobacco settlement, to support growth in the area of cancer for their cancer centers. The state of Florida a few months ago announced a plan to dedicate over $700 million to the Moffitt Cancer Center. And they have also been supporting the University of Miami since 2014 with $16 million per year for their cancer center. University of Miami, my alma mater, is a private university that has benefited greatly from the support from the state of Florida and was able to achieve NCI designation in the last couple of years. There are many other examples around the country. In Rhode Island, last January of 2022, our cancer center submitted a recommendation to the state of Rhode Island to the attention of Senate President Dominic Ruggerio and House Speaker Joseph Shekarchi for a $20 million allocation per year for the next 10 years to build and sustain, along with a one-time investment in space and renovation. We were extremely fortunate to receive a $25 million gift from the Legaretta family in 2021, and this has been transformational. But as I said earlier, it costs hundreds of millions of dollars, and our peers to the north and to the south are raising billions of dollars to support institutions such as Dana-Farber up in Boston. Where will these investments go in Rhode Island? They will go towards community outreach so that we can understand the cancers and the cancer burden and address them in different communities throughout the state. The support will go towards cancer screening programs, the currently recommended screening programs, but also new tests, new blood tests that are able to detect multiple cancers from just a blood test. And we are collaborating with the fire department in Providence, with EMS Fire Chief Zach Kenyon, and look forward to working with community health centers. The support will also go towards uncovering cancer causes throughout the state. We need to study and address environmental and clinical samples from large numbers of individuals over time to understand the genetic and environmental causes of cancer. We need to be recruiting faculty who will have research labs that will be making new discoveries and starting new clinical trials. We are working on collaborations with the University of Rhode Island, educational programs, including outreach into the school systems as early as high school. we're developing new clinical trials and working on minority enrollment in these clinical trials. And we also are working to address the burden and the increased burden of cancer due to COVID. The work that will be done will help start new companies in the future based on discoveries made here in Rhode Island. Will keep people healthier, working longer, and all of this will help the economy in the state of Rhode Island. I'd like to thank our leaders in Rhode Island for partnering with us to pass new laws, such as the Senator Mary Ellen Goodwin cancer screening law, signed by Governor McKee in May of 2021, and the cancer biomarker law championed by State Representative Mia Ackerman to have insurance coverage for biomarker tests for better treatment for patients. We have unique problems that need to be addressed to reduce the burden of cancer in Rhode Island. Screening, prevention, treatments, research, discoveries, impact on the community, education, addressing disparities, and ultimately various programs that will help the economy. Thank you for partnering with us and for your support.